Assalamu alaikum. The next topic of the white blood cell disorder is chronic leukemia. What is chronic leukemia? What is the definition of chronic leukemia? And what are its types? And what are its uh, clinical significance? What is complications? And what are its morphology? So before starting the chronic leukemia, I would like to explain the word chronic. The chronic means mature. As in previous, I've already mentioned that acute means immature cells, just like the lymphoblast cells, blast cells. While in the chronic leukemia means that these are the mature cells, the lymphocytes. These are the mature cells, the lymphocytes. And the leukemia means that it will rise in the lymphocytes. Neither there will be rise of immature lymphoblasts. And the clinical presentation it will give that there will be decrease in the blast cells of the bone marrow, and there will be rise in the peripheral blood smear of the lymphocytes. Okay, so number first is the chronic leukemia. Chronic leukemia, here the chronic leukemia is divided into two branches, two types, and that was basis on the B cells and T cells. As first of all, I would like to give the definition of the chronic leukemia as the new plastic proliferation of leukemia means the new plastic proliferation of chronic mature, and in the chronic leukemia only the lymphocytes are involved, so the new plastic proliferation of mature lymphocytes, circulating lymphocytes, which is characterized by the high WBC count. Okay, so this is the whole definition of the chronic leukemia. Now further, the classification of chronic leukemia is B cell and the T cells. The B cells chronic leukemia involve chronic lymphoblastic leukemia, and the other type is the hairy cell leukemia, and the T cells, the adult T cell leukemia. No doubt that here will be most of the complication due to virus. I'll further explain about this. Adult T cell leukemia and the mycosis fungoid, also called as the cutaneous T cell lymphoma. And for now up till, you should just trust me. These are the classifications of the chronic leukemia. B cells and the T cells. The B cells chronic leukemia is a chronic lymphocytic leukemia, and the hairy cell leukemia, and the T cells, adult T cells, and the mycosis fungoid. Here just this is the classification. We would further explain the every classes, and I will give only the important points regarding exam point of view. Most probably the KMU, Khyber Medical University. Okay. So here the classification is given about there are mostly the chronic here the chronic lympho. I will start from the chronic lymphocytic leukemia. As I've told that this is chronic, so there will be lymphocytic. There no lymphoblastic, as it is acute. They will give a presentation of acute. They will give acute presentation while in chronic lymphocytic leukemia, the chronic presentation will be given. And what is the chronic presentation means? There will be mature lymphocytes are be rise. So what is the chronic lymphocytic leukemia? The definition is the new plastic proliferation of is the class of the B cell. So here will be the B cell. But before writing the B cell, I would like to mention the naive B cell. Naive B cells. What are the naive B cells? Okay, I will explain this after completing my definition. The neoplastic proliferation of the naive B cells. These these cells co-express CD20, as the B cells have almost CD20 surface markers. CD20 surface markers. So here CD20 is present, along with the CD20, CD5 is also present. CD5 surface markers. So the naive B cells will have CD20 and CD5 surface markers. What are the naive B cells? The naive B cells, as B lymphocytes are produced, the B lymphocytes in the bone marrow. Before going further into the exposure, if there is no further exposure to any antigen, there will be no further exposure to an antigen, then this B lymphocyte is called naive B cells. So what are naive B cells? The naive B cells, these are the B cells that are not exposed to the antigen. So here naive B cells produced by the chronic lymphocytic leukemia. In the CLL, the neoplastic proliferation of naive B cells that co-expresses the CD20 and CD5 surface markers. This is worth mentioning. And here, just for a reminder, that CD5 is present on T cell, but as there is leukemia of the B cell, so the CD5 will be present on the naive B cells. Okay, what will be the clinical presentation of the chronic lymphocytic leukemia, CLL? What is the clinical presentation of the CLL? As the lymphocytic count rises, the lymphoblast count will be less. The blast cells will be less than 10% in the bone marrow. So when the blast cells is less than 10%, then there will be pancytopenia. The pancytopenia exact presentation will be anemia, bleeding, and infections. And just remember that anemia is due to the decrease in the RBC, bleeding due to the decrease in the thrombocytes, platelets, and infections due to the neutrophilia, decrease in the neutrophils. And also there will be hepatosplenomegaly, because the B cells, B lymphocytes, because all lymphocytes are concerned with the immune lymphoid tissues, mostly the hepatospleno, liver, spleen, and the lymph nodes. Liver, spleen, and lymph nodes. So in the chronic lymphocytic leukemia, CLL, there will be hepatosplenomegaly, lymphadenopathy, and pancytopenia. Okay, lymphadenopathy, hepatosplenomegaly, pancytopenia. This will be presentation of the chronic lymphocytic leukemia. So here are some important lab findings. I will discuss lab findings and morphology. The lab finding, or if diagnosis should be fine, then the diagnosis should be consist of the lab findings. What are the lab findings in the CLL, chronic lymphocytic leukemia? Number one is the CBC. We should look for anemia and leukocytosis. White blood cells rise. White blood cells rise would be 15,000 to 2 lakh. After the CBC, flow cytometry. Why is flow cytometry used? Flow cytometry is used to confirm the CLL. It is the confirmatory test. And how the CLL should be confirmed? By identifying the cell surface markers. What are the cell surface markers? I have previously mentioned that they consist of cell surface markers of the CLL are CD20 plus CD5. So the flow cytometry should be concerned with the cell surface markers. After the CBC, flow cytometry, and then the genomic study. The genomic study consists of PCR and the FISH. FISH means fluorescent in situ hybridization. Fluorescent in situ hybridization. In the genomic study, we should study the mutation in the genes. And number 4 is the imaging study. Imaging tests for CT. And why imaging test is done? Imaging test is done for to look for the enlargement of the lymph nodes. And at the end, the bone marrow biopsy and aspiration. Bone marrow biopsy and aspiration. The bone marrow biopsy will give us what type of presentation? It will give us the lymphoblasts will be less than 10%. Why? Because this is chronic lymphocytic leukemia, and here lymphocytes will rise and the lymphoblast will be low. So that's why it is 10%. Let's come to the morphology. And then morphology, what are morphology of the chronic lymphocytic leukemia? If you hear something like about the smudge cells, then what is smudge cell? Smudge cell, these are fragile lymphocytes. And what is the function of the fragile lymphocyte? Why they are fragile lymphocyte? The fragile lymphocytes are these are the specific to the chronic lymphocytic leukemia. Fragile lymphocytes, and the fragile lymphocytes will under the microscopy they will give the smudge cell appearance. How is smudge cell presented? Okay, I will give you to give a diagram, and that is these are the smudge cells. It will show a diagram. It will give presentation of this type smudge cells. They have different arms, okay, and they will only present in the chronic lymphocytic leukemia. Now, what are the complications? Complications of the chronic lymphocytic leukemia is number 1, infection. And this is the most important complication of the chronic lymphocytic leukemia, because infection occurs due to there is abnormality in the B lymphocytes, and the B lymphocytes I have mentioned previously that B lymphocytes are concerned with the protective function or protection of the body, and they protect against different infections. So if the B lymphocytes are disturbed, then there will be infection. Number 2 is the autoimmune hemolytic anemia. Why there is autoimmune hemolytic anemia? Because the B lymphocytes will produce antibodies against the body own RBCs. So there will be autoimmune hemolytic anemia. And at the end, this chronic form will transform into the B cell lymphoma. I mean, they will form a mass. They will form a mass which is clinically characterized by marked by enlarging spleen. Like if there is chronic lymphocytic leukemia, then the spleen size will be greater, but there will be no further enlargement. And in the B cell lymphoma, the spleen will continue to enlarge. So this will be the presentation. After giving brief discussion about the chronic lymphocytic leukemia, there is some classifications regarding this. chronic lymphocytic leukemia. And the classifications for chronic lymphocytic leukemia is Ray classification and the Bennett classification. Ray classification and the Bennett. The Ray consists of 5 stages while the Bennett consists of 3 stages. Okay, it is very easy to learn these two stages, these two classifications of chronic lymphocytic leukemia. The Bennett is classified on the basis of the lymph nodes involved. If stage 1 in stage 1, when less than 3 areas when less than 3 areas of the lymphoid tissues are involved, so there will be stage A. In stage B, more than 3 lymphoid tissues are involved, while in stage C, the anemia and thrombocytopenia is also present. Cytopenia. Anemia and the thrombocytopenia is also present. This is the Bennett classification. In the race classification, there will be 5 stages: 0, 1, 2, 3, 4, and 0, 1, 2, 3, and 4. 0 in 0 stage, there will be a rise of the WBCs, like the increasing complications. They are arranged according to the increasing complications, the ray classification. Increase in the RBCs, increase in the RBCs will lead to lymphadenopathy. And after the lymphadenopathy, you should just remember the HAT. HAT means hepatosplenomegaly. Number stage 4 means anemia, and stage 3 means anemia, and stage 4 means thrombocytopenia. Thrombocytopenia, like the thrombocytes will decrease, platelets count will decrease. So these are the classifications: race classification and Bennett classification. Most important for the chronic lymphocytic leukemia. And I've given the easiest way to learn is that the Bennett consists of 3 stages, and then you should keep in mind the 3 number. And after, in stage 1 less than 3, in stage B more than 3, and at the end stage anemia and thrombocytopenia. And in the race classification, 5 stages. It starts from 0, 1, 2, 3, and 4. 0 for a rise in the WBCs. The rise in WBCs will lead to lymphadenopathy, and along with the lymphadenopathy, in stage 2, hepatosplenomegaly was involved, liver and spleen is involved, and then anemia, and at the end thrombocytopenia occur. So these are the classifications of chronic lymphocytic leukemia. What is hairy cell leukemia? Hairy cell leukemia. Hairy cells just mean that there is a hair like cytoplasmic processes from the B cells. These are the hairy cells from the cytoplasmic processes of the B cells. And their hairy cell leukemia is defined as the neoplastic proliferation of mature B cells characterized by hairy cytoplasmic processes. So this is the definition of the hairy cell leukemia. It is the hallmark of this is the trap enzyme. Trap enzyme is the hallmark of it. Is positive. The trap enzyme is positive in the hairy cell leukemia, and the clinical for it is present. What is the trap? I will further explain, and I will try to clear the concept regarding the trap enzyme. For now, you just believe me that they are positive for the trap enzyme. Clinical, number 1 is the splenomegaly. Spleen will be enlarged, and the spleen will be enlarged due to the red pulp, and the bone marrow aspiration will give the dry tap. And the lymphadenopathy, there will be no lymphadenopathy. Okay, the hairy cell leukemia. Hairy cell leukemia, as I have mentioned, that this is the hairy cytoplasmic processes from the B cells, and they are positive for the trap enzyme. What is trap enzyme? Trap enzyme is tartrate resistant acid phosphatase, which is positive in the hairy cell leukemia. And the clinical presentation, it will give splenomegaly and dry tape bone marrow aspiration will give the dry tap, and there will be no lymphadenopathy. I will explain the clinical here, that the bone marrow, what is mean by the dry tap? Dry tap means that if we take in bone marrow aspiration, then there will be no lymphocytes. There will be no lymphocytes. Yes, and so here the name the dry tap. And why the dry tap occur, and when the dry tap occurs, so here the synthesis of the lymphocytes will decrease, and this will ultimately lead to increased pressure on the spleen to synthesize for the hematopoiesis. And the spleen will cause expansion, will lead to expansion, and expansion is due to the red pulp. Here it is worth mentioning because the spleen consists of red pulp and white pulp, and in the hairy cell leukemia, the expansion will be in red pulp because they are hairy processes of the B cells, and they cannot pass the red pulp to enter the white pulp. That's why there will be expansion of the red pulp in the spleen. Now, for further coming to the treatment, 2-CDA will be given, which is adenosine deaminase inhibitor. Adenosine deaminase inhibitor. Further, there will treatment is bone marrow transplantation. The easiest way to learn the hairy cell leukemia is for just remember the word trap, as these are hairy like processes. For example, in the nose, just for your learning, there are many hairs in nose, and they trap the dust particles. So hairy cell leukemia trap. Hairy means hairs. So here will trap the dust particles, so trap enzyme. And the T for the trap enzyme, and R for the red pulp. Red pulp, expansion of the spleen, splenomegaly, and aspiration of the bone marrow, which is dry, and no lymphadenopathy. So here the trap is used for the hairy cell leukemia. Okay. The B cells chronic lymphocytic leukemia ends with the chronic lymphocytic leukemia, and then uh, hairy cell leukemia. Hairy cell leukemia. These are the two subclassifications of the B cell chronic leukemia. And when the T cells involvement come, there are two classifications of the T cell leukemia. That is the adult T cell and the mycosis fungoid, which is also called as cutaneous T cell lymphoma. Now start with the adult T cell leukemia. Adult T cell leukemia. The adult T cell leukemia, as I have mentioned previously, that the T cells leukemias are mostly associated with human T cell leukemia virus. In the adult T cell leukemia virus 1, it is associated with human T cell leukemia virus 1. And the definition of adult T cell leukemia is the new plastic proliferation. It is leukemia means the new plastic proliferation of the CD4 plus T cells. The neoplastic proliferation of CD4 T cell is called adult T cell leukemia, which is strongly associated with a virus called as the human T cell leukemia virus. And the clinical presentation is the person will present with a rash, lytic, lytic, punched out, or explain this lesions of the bone, and at the end this is usual lymphadenopathy with splenomegaly, hepatosplenomegaly. This is the clinical presentation of the adult T cell leukemia. Okay, how you will learn the clinical presentation of the adult T cell leukemia, because here is only a single association of virus involved, that is human T cell leukemia virus. The clinicals are presented as the T cell just look like skeleton. These are arms, this is the axial skeleton. So the T cells are mostly concerned with the bones and also the skin. T cell loves skeleton, bones and the skin. So they will either present on the they will present on both the bones and the skin. In the bones, it will cause the lytic punched out lesions of the bone. Here I am going to mention about some extra information, that the lytic punched out lesions of the bones are mostly concerned with the multiple myeloma. I will explain this in few lectures. What is the lytic punched out lesions? These are just like if there is some necrosis occur, and there is some skin, dry skin, and you just remove that part of skin, and there will be appearance of this lytic lesions. There the dermis is removed, epidermis is removed, and the underneath surface look like seen. So these are the lytic punched out lesions of the bone. They are mostly concerned with multiple myeloma, but in multiple myeloma there is no rash. If the lytic punched out lesions of the bones are present, lytic lesions of the bones are lytic lesions are present along with the rash, then you should directly move to the adult T cell leukemia. And if the lytic punched out lesions, tumors of the bones, and along with bones, some kidneys are involved, then you should move for the multiple myeloma. So this is here worth mentioning. The adult T cell leukemia is finished. Now at the end, our last topic about the T cells chronic leukemia is mycosis fungoid, which is also called as cutaneous T cell lymphoma. Cutaneous means skin, and T cells lymphoma means the T cell will form a mass in the dermis. So the neoplastic proliferation of the CD4 T cells, neoplastic proliferation of CD4 T cells that infiltrate the skin, producing the skin lesions. This is the definition of the cutaneous T cell lymphoma, or the mycosis fungoids. The CD4 T cells will stay in the dermis, skin, and they form the skin lesions. That is, there will be rash, plaque formation, and the nodules will be formed. The CD4 T cells which present in the dermis will give nodules, and this will form nodule-like appearance, and this nodule-like appearance is called as Pautrier, Pautrier microabscesses. These nodules are called Pautrier microabscesses. And the hallmark of the mycosis fungoide is the Sézary syndrome. What is Sézary syndrome? In Sézary syndrome, when the CD4 cells leave the skin and it enters to the blood and move along the whole body, travels and cause scaling of the whole body, scaling, and this will lead to Sézary syndrome, and the morphology in which uh, the morphology of the mycosis fungoide is the Sézary cells. Sézary cells, what is how they will look like? They will look Sézary cells. Caesary cells have cerebriform brain-like nuclei. They have brain-like nuclei, just like this. These are called Caesary cells, and these cells are present in the dermis of the skin. Caesary cells are positive. Sézary syndrome is concerned is associated with the uh, mycosis fungoides, and it involves mostly the skin lesions. So this ends our topic with the chronic leukemia.